Hey guys, welcome back to Medical Coding with Blue. Okay, today's episode we are talking about when the provider selects the diagnosis and the procedure code. Now, you may be thinking, oh, this is great. All I have to do is just check the box and make sure everything's there and send it on through. Here's the thing. Providers don't always select the correct diagnosis and the correct procedure codes because a lot of times they don't understand why they have to select this or why do they have to select that. Or they may not know that they can get credit for whatever it is that they're doing. This is why you have medical coders. And the more knowledgeable the medical coder, the better off it is for the provider. But in order for this to happen, the medical coder and the provider have to partner up. They have to get to know each other, they have to talk, and they have to make sure that what the right hand is doing, the left hand knows, okay? So same thing. We have got to get on the same page with all of our providers. Now, there's going to be times when you are going to meet resistance and they are not going to want to deal with you. I know. I have many experiences with this, but that's okay because every experience that you have, good or bad, is going to make you a stronger and more well-rounded coder, okay? The point is not to give up and to always show that you have the provider's back, no matter what, okay? Now, sometimes the providers are not going to know like everything. This is when you come in and you say, okay, this is what we need to do in order for you to understand why we need this, or if the provider is repairing a laceration, why do we have to have measurements? Why do we need to know different layers that you're going through? Why do we need this much detail? There's a huge difference between getting the lowest level possible because the documentation is just not there to getting the appropriate level of like a complex repair. There's a huge difference. So that's something that you can talk about if that's an issue with your particular clinic or provider, okay? So I've made a list. So let's go ahead and get into these lists. All right. The documentation must reflect the procedure codes and the codes that are selected. If, for example, the diagnosis that is being selected is not the diagnosis that was being treated, then it is your job to go in and change it to whatever the documentation says, okay? If it needs to be queried to clarify, then you need to query and clarify with the provider. Now, here's the thing. If you're having to do lots and lots of queries with a provider, it's time to stop and not send so many queries, okay? The best thing that you can do in this situation is meet with a provider. I know this is not always possible at all facilities. Some facilities are very hands-off. They don't want the coders running around talking to the providers, or maybe the providers were complaining about their previous coders. There's a bunch of reasons why. But here's the thing. You, as a medical coder, have to bring your A game. And the only way to bring your A game is to make sure that you're educated. You are educated, you know the guidelines forwards and backwards, you know what's going on when it comes to the coding side of the house. The providers are very well educated. We all know this. But the medical coders have to be equally as educated, okay? Maybe not with all of years of experience like with education like the doctors and the other providers have, but we still have to know plenty. Okay, and there's ways of learning plenty. It's taken me over a decade to learn everything that I've learned. Trust me, I know a heck of a lot more now than I did over 10 years ago. So keep that in mind. These things take time. It's just like the providers, they had to have years of schooling. It's the same thing with medical coding. Every year, you're going to get better. You're going to progress, and you're going to learn more, and you're going to be able to explain things a lot better, okay? But you have to be able to talk to the provider. The provider has to be willing to talk to you as well. So if you have a provider that wants to meet with you and wants to talk with you, jump at it with both feet, okay? Because they, every provider is different, okay? And sometimes they're not going to want to hear from you, but it's all on your approach as well. That's why we have this list, and we're going to be talking about this, okay? The next one is, if the provider selects the wrong diagnosis or procedure code, change it or query for further clarification, like we said. Number 3, if the provider is selecting pain, but according to the documentation, the patient was injured, you would select the injury. Educate your provider about the difference between organic pain and pain from an injury, okay? Because sometimes they'll say, if the patient, let's just say the patient was in a fight, okay? I'm sitting on my feet. The patient was in a fight, and they're coming in with left wrist pain, okay? Because they punched somebody. And the provider picks up wrist pain and says that they're going to put them in a splint and send them home. Is that correct to say that the patient is here for wrist pain? Is that the correct final diagnosis? No, it's not. It's supposed to be injury of the wrist, because the patient didn't just wake up with this pain. He is there because he has a injury that is on the wrist because he was in a fight. So if the provider doesn't know yet what it is, it could be a fracture or it could be a sprain, but he doesn't know because like it's swollen or whatever, and he can't see it yet, he can still code, or she can still code injury of the wrist, the left wrist. Okay, and then you can put by unarmed brawl or whatever if that was the case. So that's what you would put in that situation. If the provider keeps doing that, educate them that it is important for them to pick up the injury codes appropriately and to pick up the pain codes appropriately. Because if it is organic pain, if the patient just wakes up in pain, there could be a myriad of things that's going on with this patient. It could be related to the bones, or it could be related to the nerves. It could be a rheumatological condition. It could be a wide range of things, okay? So this is why it's very important to be very detailed. And if they're not getting it when it comes to injuries, which it is common. I work in the orthopedic clinic, so it is common for providers to say, well, this patient is in pain. Okay, well, what happened? Well, they were in a fight. Okay, well, now we know we're looking at an injury. So that's where you have to step in and say, okay, let's work through this together. And try to work with them to understand the way that they learn. That is another thing too. If you see that they're very visual learners, then get something to give them visual aids, okay? If you see that they're more where they hear it and you can talk it out, go that route, okay? But just try everything, but just break it down as simple and as easy as possible, okay? That way that they can pick it up as well. Because you don't know what they know, or you don't know how they're going to learn. It's just by trial and error. So try everything and always make sure that you go in very professionally from top to bottom, okay? And what I mean by that is you have to go in there and you have to have professional voice. You don't want to be like, oh, you know what I mean, with gum or anything. Do not chew gum. I've seen so many coders go to their providers with gum. Oh my gosh. It's like, no, what are you doing? And so, no gum, okay? Make sure you're well dressed and make sure that you have your references with you. Whenever you go to meet with them, make sure you have your references with you. If you're getting it from the CPT or the ICD-10 book or even the PCS book, if you're doing inpatient stuff, make sure that you have it with you so that you can show them something official, okay? And only bring them one thing at a time. Don't try to like fire hose them and give them a bunch of things. If there's one really huge thing like the injury coding that's pressing, talk about that first and get them comfortable with it first, all right? But make the time to go to them and spend time with them, because while it may seem like, well, I don't have time, they can make time. There's time that can be made here and there. And, you know, even if you have to kind of just keep at it until they give you a couple of minutes, okay? And they will, because eventually when they start to see you a little bit more, they get more comfortable with you, they'll start to come around. But it's all about marrying that good documentation and good coding. Okay, that's the goal. Next one. Okay, next one. Review the surgery note when it comes to coding surgeries. Don't just take their word for it. I have seen this many times. Let's just say, for example, the provider did a laparoscopic appendectomy. Now, I can't think of the code off the top of my head, but that's what they title their encounter as, their surgery note as laparoscopic appendectomy, and then whatever the procedure code is. So some coders may think, oh, that's the code and that's the diagnosis, whatever the pre-diagnosis is. I'm just going to go ahead and select that and move on. Wrong. You have to document. You have to review the document, okay? You have to make sure that everything is there to support that laparoscopic appendectomy and the diagnosis. Now, when it comes to like diagnoses like that on a surgery note, you're going to be looking for the path report, okay? The pathology report, especially if they took something and they sent it to pathology to make sure it wasn't something else, or it wasn't, there's not a more specific diagnosis code for that, okay? Because they could say acute appendicitis, but then when they, take it back to pathology, it's something even more, okay? Something more specific. So that's the thing on that one. Read through the documentation to make sure, okay? Because like I said, that laparoscopic appendectomy could have been converted to open. And the provider didn't go back and change it because maybe he's using a template, but he's just filling in the blanks in the body of the note. Or maybe he's performing another procedure during the surgery because something else happened, okay? And he had to do something else. He would be losing credit if you just selected whatever he selected because maybe he didn't know that he could get credit for something else. That's why you have to read the note and don't just take their word for it, okay? I've seen so many coders do this and it's terrible because, like I said, the provider is going to end up losing credit because of that, of just trying to quickly get through it. No, you have to look at it. So look at it and pay attention to it and be very careful when you are selecting those procedure codes, okay? Make sure that everything is there, all the documentation, okay? The next one. If you're being told this is the way we always do it, verify. Verify that those codes that they are, those codes that are being selected are correct, okay? You have to make sure that even though they say, oh yes, these are the codes that we use, are you sure they're correct? When I took over for the pulmonary clinic, they said that you would pick up the pulse ox and you would pick up all these other codes. No, I knew that was wrong. And I hadn't even coded for pulmonary yet. I knew that pulse ox code was wrong. No, it's wrong because it's already included. In the procedures that it was talking about that they were doing, it was already included. There was no need to separately pick it up, okay? So you're always going to make sure that you verify everything. And as it turns out, what they had documented in pulmonary was not correctly captured in the procedure code that was being selected. So I made sure that I went in and got the other code. And this caused a lot of friction, okay? Even with my boss. She was like, no, Blue, you're going to pick up this code. I told you to pick it up. I said, nope, because it's not there. If it's not there, it didn't happen. And she's like, no, it is there. And I said, no, it's not. And so we went back and forth, but I was able to show her in the end. I did talk about this on a few episodes ago. All of a sudden, I'm getting all these messages now. I have my phone on auto reject, but still. Anyway, I was getting all of these pushback from my boss and things like that. But when I was able to show her the verification that I was selecting the correct diagnosis code and I understood what was going on and the correct procedure codes, then everything worked itself out, okay? And the pulmonary clinic benefited from this, okay? So it's always going back to the details. Don't get lazy. Whatever you do, don't get, oh, I just want to cut corners and get this done. Make sure everything is there, because every encounter is different and every provider is going to treat every single patient differently. Okay. So make sure that you watch for that. Okay. And it's not argumentative. Okay. If you are just double checking to make sure, okay, it's not argumentative. You're just making sure that everything is there. Okay. And the next one, if the provider tells you you will report this code or procedure, and it is not correct, show them why. This is where it's not being confrontational. It is being clear and to the point. If they are not selecting the correct diagnosis or the correct procedure code, and they're telling you you will report it this way, don't get bullied into it. Okay. If it is not correct, it is not correct. You can tell them and explain to them why the code is incorrect. But make sure that you know what they're saying, because sometimes what they're thinking that they're reporting is actually not what they're reporting. So this is why you have to make sure that you're communicating with them. Well, sir or ma'am, I see that you have selected this procedure code. It's not reflected in what you've been documenting. Well, I am not going to do this or that or whatever, and that's what I'm going to select, and that's what you're going to pick up. If it's not correct, then you need to tell them why it's not correct, and you need to explain to them the use of a better code, okay? So that's that one. Let's see. The next one is the diagnosis and procedure codes have to be written out. Now, I have seen providers try to pull this one. They'll put I-10, which is the code for hypertension, and not spell out hypertension. So I always kick it back. You got to spell out the hypertension. Well, Blue, I already have the code there. I understand that. But if you're just coding off of memory, and I don't know if you're coding off of memory, okay? I don't know if you're using a drop-down box or something like that, and you didn't accidentally select the wrong one. This is why it has to be written out in the note. Okay, it is unacceptable to just have procedure codes written out in the note or diagnosis codes written out in the note without the correlating documentation to go with it. Okay, you have to make sure that they are together, and you have to make sure that all of those diagnoses are reflected throughout the note or supported. Okay, it's all going back to the supporting portion of it. Okay. So that's that one. But yeah, don't let them just put the procedure or diagnosis code in there just by the number or by the letter. They have to be able to spell it out. Okay. The next one is injury versus orthopedic aftercare. I could do a whole episode on this one. If the patient is in the post-op period, right? And sometimes even when they've had a cast set in its 90-day global period, it does confuse providers. Well, I never went to the OR. Why do they have to get this aftercare, this 99024 CPT code? Because they're still in the global portion of their procedure, right? And if it was just a reduction or whatever, that's when you'd have to do something like that. Now, injury versus orthopedic aftercare. Sometimes they will report both of them at the same time, thinking it is orthopedic aftercare because they had a surgery. Maybe they had a surgery, and but it was to repair this fracture or this other injury. Make sure that they know and understand that it is just the injury code when the surgery or the procedure was just for the injury. Okay. So even though they've had a surgery and they technically maybe don't have a fracture anymore, it is still not orthopedic aftercare. It is going to be the fracture. Okay. So the injury is always going to carry through all the way while they're being treated for it. Okay. And then if it's a sequela later on, that's something different. But for the purposes of illustration, your initial or your active treatment is going to be with that 7-digit character of A. And then the subsequent treatment is going to be with the 7-digit character of a D. Okay? So, and I will talk about sequela and all this subsequent and initial on another episode. But always make sure that they understand that the Z codes are for organic conditions only. If it is orthopedic aftercare and they were doing a surgery for their osteoarthritis, that is an M code, right? So that M code is going to kick over to the Z code in the aftercare. So that would be orthopedic aftercare, not the M code, right? It's going to be orthopedic aftercare in that instance, because that orthopedic aftercare marries up with these organic conditions, which is what the M codes are. Okay, but if they were injured, they're going to carry that injury code throughout their aftercare, okay, and not orthopedic aftercare. Right? So the next one and the last one, provider. Gosh, this time just freaking flies, I swear. Providers are not meant to be coders, so make sure that you clarify what is happening. All right. They are not meant to be coders, okay? And some get very upset when they have to do all of this coding stuff, okay? And they will complain and they will be very spirited, okay? That's a word I like to use, spirited. When they're talking about the fact that they have to do all this documentation and why do they have to do it and why is it so important? And this is just common sense, okay? And that's what they say. It's just common sense. And I understand it is common sense. However, we as medical coders can't assume anything. And we have to be able to support everything that we are selecting, okay? Because we are responsible that these records are coded accurately, okay? To capture all of the information accurately. You have to really care and know what you're doing when you are a medical coder. And yeah, it's going to seem like a lot in the beginning. And even if you're a veteran medical coder, it's still going to seem like a lot. It is. That's the challenge part of it. The joy comes when you are coding and you see this wonderful, beautiful documentation from your provider that you've trained and you've spent hours training. And then you see that they have selected the correct diagnosis and the correct procedures all on their own. And you see that they've selected the correct level, evaluation and management level. And when you've seen them go from being very against anything that has to do with medical coding to they understand it and you're a part of that, that is such an incredible feeling. I know I must seem like the hugest nerd ever, but when I've had these experiences, it's just so career fulfilling when I see that. And I get so excited and it just makes me want to do it even more, you know? And I mean, I even have my moments where I'm like, I don't know whether to laugh or cry because you get so proud of them and you're part of their success, okay? Because it is a successful thing. Every time a provider gets interviewed, okay, because I've talked to quite a few, every time a provider gets interviewed, one of the questions that they always come back to me and tell me is, Bleu, do you know what? They asked me about medical billing and coding. And they asked me what I know. And I told them, I know this, this, and this because I remember your coding tips. And I got the job. When I hear that, it is so, like, I've heard it a few times already. And it just, like, I don't know if you can see, like, my eyes are starting to tear up. It is such an awesome feeling because they know and they get it. So sometimes when they first get around you, they're not going to get it. But be patient with them. Please, whatever you do, be patient with them. And know that they're not going to understand you right away. You have to learn to communicate with them, okay? But break things down as simply and as straightforward as you possibly can, because that's the best way, okay? Then you can work on finesse later. But everything has to be supported. Everything has to be documented. And when they understand this and they see in their numbers that it's all reflecting and that it's trending upward, the amount of revenue they're bringing in and not trending downward, they'll know it's because you helped them. Okay. Now we're going to be going into a lot more of these provider geared episodes where I'm talking about my point of view when it comes to dealing with these providers, because that is one of my strong suits. I like dealing with providers because that is one of my most favorite things. I like doing classes. I like doing the interaction things, but it took me time to get to this place. Okay. So keep studying. If you're out there, just keep studying and keep applying yourself. And do like I said, I suggested reading those body language books. It's very important, especially when you start getting around them and you start having to explain this stuff. You're going to be able to know, are they being receptive or not? And if they aren't, then you need to change your approach, okay? That maybe you're saying something that's not as clear. So again, look at those body language books, get the base understanding of it. So that way it'll help you. That is your own little secret weapon, and that's you applying yourself, okay? That's my advice on that one. So I'm going to go ahead and wrap this one up. But I'll be back tomorrow for another episode. I'm working on it. So I will see y'all again tomorrow. Thank you so much to all my new subscribers and to my subscribers that have been with me for the longest time. Thanks, you guys, for being in it with me. I really appreciate it. All right. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.